India has 36 states and union territories, but here's a question most people never ask. Which ones are actually managing their money well, and which ones are quietly running into a financial wall? Government's think tank NITI Aayog put out its second Fiscal Health Index on Wednesday, a report card that scores India's major states on how they earn, spend, borrow, and manage debt. And the results are revealing. Odisha tops the list, Punjab is dead last, and several states that were doing okay last year, Karnataka, Tamil Nadu, Chhattisgarh, have slipped. I'm Brinda Tulsian, and you're watching The Print. Today, we are going to break down what this index actually measures, who the winners and losers are, and most importantly, what it means for you, the ordinary citizen, when your state's finances are in bad shape. First, let's understand what we are actually measuring here. The Fiscal Health Index, or FHI, is published by NITI Aayog, the government's policy think tank. It scores states across five pillars. One, quality of expenditure. Is the government spending on things that create long term value, roads, school, hospital, or is it mostly paying salaries, pensions, and interest on old loans? Two, revenue mobilization. How much money is the state actually generating on its own through taxes and fees rather than depending on transfers from the central government in Delhi? Three, fiscal prudence. Is the state living within its means or is it running persistent deficits, spending more than it earns year after year? Four, debt index. How much has the state borrowed and what percentage of its income is going just towards paying interest on that debt? 5. Debt sustainability. Is the state's economy growing faster than its debt? If your debt is growing faster than your economy, that's a warning sign. Based on these five scores, states are placed into four categories: achievers at the top, then front runners, then performers, and at the bottom, aspirational states. That last category is essentially a polite way of saying these states are in fiscal stress and need to urgently reform. So, who is doing well? Odisha is the clear number one with a score of 73.1 out of 100. That's up from 67.4 last year. What makes Odisha stand out? Its debt is just 18% of its state GDP. It spends nearly 80% of its budget on developmental activities, and its interest payments are only about 6% of its revenues. That is genuinely healthy public finance. Goa is second, Jharkhand third. Jharkhand is an interesting story. It was ranked 13th a decade ago. It has steadily climbed by keeping capital expenditure high and deficits low. Gujarat is fourth, Maharashtra fifth. These achiever and frontrunner states share a common profile. They raise more than 60% of the revenue from their own sources rather than waiting for Delhi to send the money. They invest 4 to 5% of their GDP in capital projects and they keep their fiscal deficits below 3% of GDP, which is a standard target set under fiscal responsibility laws. Now, the other end of the table, Punjab scores 12.4 out of 100. Its outstanding debt is now more than 48% of its state GDP, and it's spending over 20% of everything it earns just on interest payment. That means 1 rupee in every 5 earned by the Punjab government goes straight to creditors before a single road is built or a single teacher is paid. Kerala, West Bengal, Andhra Pradesh round out this aspirational group, the bottom four. These states are running persistent deficits, often breaching the fiscal responsibility norms that the law requires them to follow. Their committed expenditure, meaning salaries, pensions, interest, is eating up to 50 to 60% of their entire revenue. That leaves very little room for anything else. And Andhra Pradesh debt has grown by over 60% in just 4 years. Between 2019-20 and 2023-24, that is a very steep trajectory. Now, this is a second edition of the index, so we can also see who's improved since last year and who has slipped. The most dramatic fall belongs to Chhattisgarh. On the fiscal prudence pillar, managing deficits, its score collapsed from 56 last year to 7.4 this year. The report attributes this to a surge in welfare spending. Chhattisgarh dropped from second to sixth overall. Karnataka and Telangana were both in the front-runner tier on fiscal prudence last year. Both have downgraded to performer this year as welfare commitments and subsidies push their deficits up. Tamil Nadu and Kerala have now been placed in the aspirational category on fiscal prudence. Tamil Nadu, despite having one of India's larger economies, has not been able to consolidate its deficit because of extensive welfare programs and salary commitments. On the positive side, Haryana moved up 3 places overall. Bihar recorded a revenue surplus this year after several years of deficits and has been upgraded from aspirational to performer on fiscal prudence. Though the report is careful to note that Bihar's finances remain heavily dependent on transfers from the center. And Jharkhand and Uttar Pradesh have both been upgraded to achiever status on quality of expenditure, reflecting a real push to increase capital spending. This year, for the first time, the index also covers the 10 northeastern and Himalayan states, ranked separately because their fiscal situation is structurally different from the major states. These states get 60 to 90% of their revenue from central transfers. They have very limited ability to raise their own taxes. Arunachal Pradesh tops this group, followed by Uttarakhand and Tripura. At the bottom are Himachal Pradesh and Manipur, both carrying debt levels of 40 to 50% of their GDP and rising. Here's why all of this matters beyond the rankings. State governments in India account for two-thirds of all public spending. When a state's finances deteriorate, it's not an abstract accounting problem. It means less money for hospitals, less money for school teachers, less money for roads, and more money going out the door as interest payments to bond holders. The report also places India's situation in a global context. Total public debt hit $102 trillion last year. 46 countries are now spending more on debt interest than on either healthcare or education. India is not there yet at a national level, but at the state level, Punjab is already in that territory. NITI Aayog CEO Nidhi Chibber, in a foreword to the report, frames the challenge directly. India's states vary enormously in their fiscal capacity and constraints. Some have made real progress, others face mounting pressure from rigid spending commitments, weak revenue bases, and rising debt. And without a systematic evidence based way to track all of this, which is what this index is designed to provide, it becomes very difficult for policymakers to know where to intervene and how. The Fiscal Health Index won't make headlines the way election result or budget speeches do, but the numbers in it matter more to most people's daily lives than many things that do. If your state is in the aspirational tier, running high deficits, piling up debt, spending half its revenue on salaries and interest, that has consequences. Roads don't get built, hospitals don't get funded, and the next generation inherits the bill.